Welcome back, everyone. You are enjoying another episode of Fast Facts Pharmacology Edition, brought to you by a Tale 2 hygienist in partnership with Elevate Oral Care. And now, please welcome your host, Tom Viola.
Hi, I'm Tom Viola, a certified pharmacist, dental educator, and author. Stick with me, and I promise to make the next few minutes the best pharmacology learning experience you've ever had. Hi everyone, Tom Viola from Pharmacology Declassified with yet another Fast Facts Pharmacology Edition. Well, we're still talking about opioids, and we want to be able to explore the best ways or the most appropriate ways to prescribe an opioid. But prescribing an opioid appropriately goes beyond prescribing from the clinical standpoint. It really is a matter of getting to know your patient very well, knowing their idiosyncrasies, knowing them well enough to be able to prescribe them an opioid and feel confident that they're going to use that opioid appropriately and make sure that there's no chance for diversion. Well, how would I get to know a patient that well? It all comes down to communication. Okay, so if anyone would ever tell you how to prescribe an opioid, they would tell you it would start with identification of the potential for substance abuse. Really, why would I assume all my patients have substance abuse issues? Well, the thing is, we don't know who and who doesn't have substance abuse issues, so we have to ask, right? Well, how do you go down that road? How do you identify substance abuse? Well, in the first case, it's going to be reviewing the medical history. Getting the patient's medical history, getting a complete and accurate medical history is tantamount to understanding the patient from their historical perspective. So where have they been? What have they done in the past? And what is their medical history so that we know exactly what to look for as far as trends from their past that we may be able to apply to the future. So knowing their medical history, very important. But beyond that, of course, it's the patient interview and asking those really difficult questions. Questions you don't want to ask, like, have you had or do you currently have an issue with substances? That's not an easy question to ask a patient in the midst of a conversation or even to start a conversation or even to end a conversation. It's just not an easy question, and yet it has to be asked. And you need to get an affirmative or negative answer one way or the other because that's your best way of determining if prescribing an opioid for that patient is appropriate. The bottom line is if there's any issues with substance abuse in their past, an opioid is not a good choice for them. Well, what if the patient says, I don't know, I've used substances in the past, but I don't know if I necessarily have an issue. How would I know that? Well, there are screening tools you can download online from like the NIH's website. Surveys that patients can fill out to give you the, numbers to add up to kind of get you an idea of whether or not the patient really has an issue or not. And of course, it goes without saying that you'd want to also review the PDMP, the Prescription Drug Monitoring Program. Now, every state calls it something different, obviously. They all have their names for their PDMPs, but they're all known generically as PDMPs. And that's the database that you look patients up in to determine what other medications they're taking, other controlled substances they're taking, and other maybe opioid antagonists they're taking. So you know enough about that patient to know whether or not to prescribe an opioid and how to prescribe an opioid for them individually. Is there more to it than that? You bet, but that's the subject of our next Fast Facts Pharmacology Edition. Until then, my friends, I say what I always say. Have a good day, every day, and be well. Oh, and one more thing. If you want to hear more from me, be sure to follow me on Instagram, Facebook, or visit my website at www.tomviola.com.
Thank you for listening to another episode of Fast Facts Pharmacology Edition, brought to you in part by Elevate Oral Care, creators of the innovative and proven prevention-focused oral care products from Advantage Arrest Silver Diamine Fluoride to Fluoramax Sodium Fluoride Varnish. Learn more by visiting www.elevateoralcare.com and schedule your free CE staff meeting today. We'll see you next time for another Fast Fact.